space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Rednam.
Welcome to the Confidence Doc podcast. I have again my special guest, Erin Ho, on today. Say hi to everybody, Erin.
Hi. I feel like you need like a little piano tune.
We do have music.
Oh, okay.
So Erin wanted to talk about something. This was her idea, and it is such a good idea because I think it's very relevant today. And we wanted to talk about weight loss medications.
Mm-hmm.
It is a very hot topic. Everyone thinks they can do it.
Everyone thinks they can be on it. It's like advertised every other advertisement commercial on TV.
Mm-hmm. Some people are very positive about it, and some people are cruelly negative about it.
Yeah. I have personal opinions about this, but I think it's important that people get good information, good facts, good data, and to really decide whether they should or should not take it, and then what are their risks when they do, and how they should take it too.
So, Erin, you do a lot of these consultations.
Mm-hmm.
So let's talk about, in our practice specifically, we don't necessarily advertise as that we offer the GLP-1 medications. It's more if we have patients who are already established, patients who've either had surgery already with us or maybe having surgery and need some help, that we kind of offer it, right?
Right.
So when you start talking with somebody about it, how do you start that conversation?
Usually, I don't usually start that conversation. The patient starts that part. They usually want or start by saying, I really need to lose some weight, or I would like to lose some weight. I've tried a lot of things. I'm exercising, I'm dieting, except I'm not getting the results that I want, or I have been getting, but I hit a plateau, X, Y, and Z. For whatever reasons, they're like, I just really would like to lose X, Y amount of weight. For whatever reason it is. There are a lot that have to do with, because we help breast cancer patients and take care of them, a lot is post-chemo weight.
Mm-hmm.
So that's one of the most common ones that I've seen. Today I heard on a radio where an orthopedic surgeon who does knee replacements, his patients, he would require them to lose weight because under certain BMIs, it's safe, right? And so he has started prescribing semaglutide or tirzepatide for his patients to get them under that safe weight to have surgery for the knee replacements. And so usually the patient brings it up. It's not so much something that I say, oh, you should get on Ozempic. I'm not a salesperson. I don't do well in sales. Therefore, I'm in medicine for that specific reason. But yeah, usually patients bring it up because they want to. They've heard about it. They just want more information. The saddest part, though, is they say it in this hushed tone, and they get kind of quiet and can you tell me about it? And I want the information to be more accessible, accurate, medically, with evidence-based medicine information provided out there that's accessible to people. Because people want it, but they don't really know anything else about it, the fact that they're going to lose weight if they take it. So that's how that kind of starts.
You know, it's funny. I did a poll. I did a short video describing plastic surgeons and our offices and our roles with using weight loss medications. And I took a poll, just curious, do you think that an office like ours should prescribe these medications?
Mm-hmm.
And while I'd say the vast majority of people were yeah, sure, there were still quite a few people who were oh, that's totally inappropriate. And like I said, we don't really advertise this per se. I think that the reason we kind of ended up offering it is because people trust us. Like we make good relationships with our patients. And because they felt this trust with us, then that's why they're like, I've been thinking about it and they're choosing to ask us about it.
Yeah.
I put that up there. Obviously, I disagree. I do think that we are an appropriate provider for this medication, but I just thought that was interesting that like, there were quite a few people out there that are like, well, no, why are you prescribing this?
Yeah. There are also a lot of people saying, oh, why you're cheating or you're taking the easy way route. And in plastic surgery, you say it all the time. Plastic surgery is not the easy way route. Like taking medications for weight loss is not the easy way out. There are side effects and there are, repercussions to it. And it's expensive. It's not cheap. It's not free. Like it's not easily accessible either. It's not easy to get either, I feel like.
Exactly. And I mean, but those same people will tell you that bariatric surgeon is the easy way out. And I understand. I think it is a combination of one is sometimes it's that person may not have access to it for either financial reasons or other reasons. And so they're upset. They're bitter about it. Some people just always want to find a reason for why, like there's nothing's easy in life. I looked at it when these medications first started coming out is like, wow, this is amazing. There are so many people that struggle because food addiction, because they have genetic reasons towards obesity. And like, if we can help those people and we can get them on a healthier track, why is that a bad thing? They have to suffer to be able to lose their weight.
Yeah.
Like, I mean, where did that mentality come from?
Yeah, I don't agree with that. I don't like if you have high blood pressure, you take blood pressure medication. You have to also cut your salt intake. You also have to watch what you eat, no processed food. You also have to exercise. Oh, wait, that's the same thing. So if you have a high BMI, if you're overweight or you have unhealthy body weight or it's just weight that you don't want, there's a medication for it. I don't think it's fair that people are saying that it's taboo or that you're cheating. I don't think it's cheating.
No one's like, you're cheating because you're taking your blood pressure.
I can promise you every single one of the patients who are on semaglutide, every single time I talk to them, most of them have a personal trainer. Most of them have already invested in a personal trainer who already counts their macros, who counts their protein intake. They count water intake. They're healthier than I am. And they have worked so hard to maintain or to lose or to get to a healthier body weight or to their number of a goal. But they're just, they just needed a little help. And I don't think that's fair that they feel shameful to say that they want to take this medication, that they need it.
And we do see that unique population with our breast cancer patients, especially after chemo. And these are people who, before they had cancer, had totally different physiques, different bodies, and, and they're beaten down and they are trying everything. And this is like sometimes for them just the switch to be able to be like, I can get back on track to where I need to be. And I think that's a pretty amazing thing that we're able to help them with that.
I think patients who go through breast cancer I think it changes you so much from the surgeries that you have to go through, the chemo, the radiation.
Sometimes they're on hormone blockers afterwards.
Exactly. Some people get hysterectomies super early and it changes their whole body. I mean, like with everything that you go through and the side effects. So yeah, I'm all for if this makes you feel better and if it helps you and if it works. Although there are certain people who cannot take this medication, right? So contraindications for semaglutide and basically all the weight loss GLP and GIP medications are medullary thyroid cancer if you have a history of it or if you have multiple endocrine neoplasia. The research that they have said that in the mice it's shown to increase your chance of having those cancers again. And especially for people who take care of breast cancer patients, that's not worth the risk. And so I'm not worth the risk. So if you have like thyroid disease and stuff like that, I wouldn't personally do it. I don't think that's worth the risk. And
we've turned people away with that and then, found out that they got somebody else to prescribe it. It's like, it's just like with any medication that we have to look at the risks and benefits. And in that case, it just does not seem worth it.
No, I know, which is crazy because there are some places out there that will, like you have a history of thyroid cancer and I personally don't feel comfortable with that, but I'm also not an endocrinologist, right? So I think I would leave it at,
so in that case, it may be better that that
specialist.
person is with a specialist for it. You know, I think the scary part is that there are so many people that have access to it. And I will tell you, we personally get ours compounded. You know, most people are not getting brand names unless they're going through their insurance because it is just not affordable. So most of us are going to use something that's compounded. And, you know, I trust the pharmacy we get ours compounded from because we've seen patients with good results. But you don't know, especially if the price, just like anything else, is just too good to be true. What are you actually injecting? So you may be getting something that's sort of that medication, or you may not be getting anything really at all. So I think you need to make sure you're going to someone with proper credentials. And these are things that you should be able to easily find. It shouldn't be like, I'm not sure what this person does.
Yeah, like there should be a pharmacist back and behind the compound pharmacy and stuff like that. Because I've had some patients actually ask me, like, is it safe to get from a compound pharmacy? Just because it's not from, you know, the pharmacy like CVS, Walgreens, from the medication, from Novodisk or whatever.
Yeah.
And so I would say that you have to develop that trust with, or you should be able to trust your provider, and they should be able to provide with you the credentials properly and list you all the risks and all the benefits and do the proper lab testing and stuff like that.
And we actually use a lab that is in Houston, which is really nice because, you know, I physically pass them some days when I'm driving. I think that it's important too that if you're getting your medication from a place that isn't asking you about your diet, isn't asking you about your exercise, isn't asking you what things you've done in the past, it's just like, oh, you'd like this? Here, sign for this and pay. That's a huge red flag. They don't care about what your results are. They're just trying to sell you a service. That's it.
So I just saw a paper in, I think in Europe, they're trying to see if they're able to achieve like the same amount of weight loss with less medication, but they enroll all their patients into a weight loss program. So this weight loss program, not only does it talk about, not only do they provide you the medication, but they put you on a nutrition, like value plan, and like they tell you what you should not eat. You have an exercise plan, and it like labels everything out for you. And so far for the past, I think they've done it for 6 months now. So far, they've shown they use a third of the medication. So the dosing that they use is significantly lower, and it's also maintainable. So 6 months after they got off the medication, that they are able to maintain their weight loss, which is the interesting thing. I want to see how patients who get on this medication lose significant amount of weight with this medication. I want to see how they maintain
Long term.
Yeah. I think the wholesome part of like weight loss, like with exercise, lifestyle, management, stuff like that, I think that comes into a huge play to after.
And I think we'll start seeing that more as like it's been out longer for the purpose of weight loss. I think also some people think that this is kind of like, I'll just get on it for a month and lose it for, you know, my beach vacation. And that's not how this works at all. The lower dosages in that study, if that works, is great because at higher doses, there are more likelihood of having side effects. Yeah. Really common ones are nausea, having, GI upset, things like that. And so if you're experiencing those things at higher doses, you have to kind of start your way up. So your first month, you may not notice anything.
No, actually, most don't. So I always tell patients, like, if you're going to start on semaglutide specifically, you don't usually actually notice any weight loss, like the first 4 weeks. It isn't until usually like month 2 or 3 that you notice like 3 or 4 pounds at most. Just because it's such a low dose, but it's like building your body up, right? You don't want to just hit the ground running. You want to slowly be able to tolerate the medication too. Yeah. Just because there are side effects to it.
So we know these meds work, but let's explain why they work. It's not just one reason why they work.
Right. So everyone knows it as the GLP. Semaglutide specifically is like known as the GLP. So it affects your pancreas and your insulin levels and stuff like that. So originally it was supposed to be for diabetes, is to help control your blood sugar. And from that, one of the side effects with the patients who were taking this for blood sugar control was actually weight loss. I think it helps a lot with the reward system as well. People enjoy snacking. I enjoy snacking. And so like you snack, you get rewards from that snacking. It lights up a center in your brain. That brain then shoots out signals to your stomach to like want more snacks, right? Because we like things that make us feel good. Chocolate is my
You
chocolates
remember
and
Cheddar
chips.
goes
Chocolates and chips. Yeah.
sweet and salty.
Yeah. That would be it. And then for tirzepatide, it's actually a dual receptor. So it's not just one, which is why tirzepatide, I explain it, it's like it's the bigger sister. It works it works on 2 different receptor hormones and stuff like that. So
And for a lot of people, they're able to achieve some of that weight loss because it literally turns the volume off on that feedback. So they don't have the cravings, or even if they have it, it goes away quickly. Like they have a bite and they're happy. And so I remember reading like this article where they were talking about this. And this one woman literally said, this voice that has been in my head for so long is just gone. And for her, that was more important than anything. That since that was gone, then she could stay on track and do what she needed to do. Again, it's just like why we're shaming people for something that's doing a lot of good. One of the reasons people feel that this is a problem is because they're like, you're taking this away from people with diabetes. And that's just not the case.
the medication's out there.
Yeah.
I mean,
if it's being compounded, and it's not like that would have then gone to a diabetic patient. The big companies, the big drug companies making all these, the medications that are for patients with diabetes are still for patients with diabetes. So it's not the case at all.
One of the ways that the medications, the main way I feel like that the medications help with the weight loss is it slows your stomach emptying, right? Which for surgery, that affects us a lot.
Yes.
But basically you hold onto your food a little bit longer. Imagine it's like a plumbing system and it just holds it in your stomach a little bit longer because your stomach it's like your second brain, right? It shows a lot of your health. It sends a lot of signals to a lot of part of your bodies. And so it's just telling you that you're full for a little bit longer, so you hold on to the food a little bit longer.
Because it's not only stomach has stretch receptors, so you have a certain amount of fullness, you feel more set, but then there's also hormones that are sent out because of that tell you you're okay. That we're done. We don't need anymore.
You don't need more.
It's not that like, oh my gosh, I'm at the appetizer stage and I need to eat all those chips and salsa. But it does. It works both physically and on the mental feedback when you're hungry. I think that like also the other question is like, well, if we get on these medications, do we need to be on these medications forever? And
so if you're type 2 diabetes, yes.
Yeah.
Yes, it helps like your control your blood sugar. But for weight loss, that's an interesting conversation. I don't know.
And I think that they're still trying to figure this out. I think that's why they're doing these studies where like, can we do lower dosages? I know people who have been on them and then gotten off of them, and then they say like they taper down their dose to a maintenance dose, or they decide to I'm going to do it every 3 weeks. And that's just them trial and error. We don't know for sure yet how to deal with this, but I do think it's an exciting area because obesity is one of the biggest problems in this country and in many other countries. And so if this is a way for us to reduce a big risk factor for a lot of other diseases, then I think it's something we need to put more time and effort into studying and understanding.
Yeah. Which is crazy because I love America. But oh my God, I went to get ice cream the other day and I think there should be a sugar tax. I asked for one singular scoop of ice cream. I just wanted one. And this lady hands me a cup. It was a 16-ounce cup of ice cream, just filled to the brim. There was no air bubbles in there. And it was just filled to the brim that was one singular cup and one singular serving. I thought that was a serving for a family. And I said, I think this is someone else's order, ma'am. Like I only ordered a single serving for one person. She goes, oh, that is our single serving. I looked at her baffled. I mean, I was just baffled. Like it was an entire 16-ounce cup for one person. And one person was supposed to eat this in one filling because it's ice cream.
Yeah.
Like, it's going to melt. So like you're eating it or you're throwing it away. And so I was just, it just blows my mind. Like America eating culture.
We have a lot of excess and a lot of waste, and we could solve more than one problem by reducing our portion sizes. For sure.
Yeah, for sure.
I think that like when we use these medications for, like you said, around surgery, we do have to stop patients who are not diabetic because of the risk. If your stomach is holding on to food a little longer, then the chances are when you fall asleep for anesthesia that you might aspirate, which means you actually throw up and it can get into your lungs.
Yeah.
And so that's why we do voluntarily have them stop that. And then they can generally start that back up after surgery. for anyone who is diabetic and has to be on these medications, then the anesthesiologist is aware of this, and they're going to do a different type of way of putting them to sleep quickly in order to try to prevent that risk.
Protocols. I feel like other things that like would show signs that you should probably stop taking the medications if you're having like abdominal pain, which usually shows that you're probably having some sort of pancreatitis, because both of these medications, semaglutide and tirzepatide, it works in your pancreas to increase your insulin receptors, right? It makes it more friendly so that your insulin like binds to it a little bit more so that it has a longer effect. But it does work on your pancreas quite a bit. And pancreatitis is no joke and it's no fun. And so if like sharp shooting pains for the abdomen, I usually tell patients like, that's an immediate sign to like, 1, go to the ER, get help, and 2, you need to stop the medication.
People will also stop this medication because of just terrible nausea and vomiting. Now, most people will have a little bit of nausea the first couple days when they have their shots. But if you're just having intractable nausea and vomiting, like you can't live that way. So it's not safe. You're getting dehydrated. So that would be another reason to stop. We do have some people who I would say we have more people who we prescribe after surgery than we do before. But I do think that there are times, and I have partners who do use it to help patients get to a healthier weight to be able to have surgery. So I think there's a role for it in both places, but I still think at the end of the day, no matter when you're doing it, before or after surgery, never having surgery and doing it, that you should still be doing it with the thought process that I'm going to make some lifestyle changes so I can keep my results.
Yeah, I would not prescribe it to someone whose main goal is to lose weight and only use this medication. That's not a sustainable way to do it. And I think that they said it was like 15 to 20% of people who take these medications have a very delayed response. So it takes them up to 24 weeks to 72 weeks to lose 5% of your body weight. So you will lose weight. It will just take you a really long time. And you could be that 20 or 15% and you would never know. And so just relying on this medication alone is not the best practice.
But also this medication coming out and being like as in the media as it just goes to show you like people's relationship with weight and how there's still so much negativity associated with being overweight or obese. The Met Gala happened not that long ago, and they were like, the Met Gala brought to you by Ozempic. And it was like, y'all, like, it is like, I laughed too, but like at the same time, I'm like, it's just because that's how it's treated is, oh, this is just what rich people do to get skinnier and even skinnier. But the vast majority of people using these medications don't fall into that.
No. And whether you're rich or poor, if this is one way to help you lose weight, like, I'm here for it. I'm here to, like, the information's out there. Like, I don't think it's just specifically for anyone, but it's interesting Hollywood's influence on social media, like social media and Hollywood's influence on people in their body.
Because that's really how we in this country got the introduction to it, was like all of a sudden these celebrities were showing up that maybe had typically always been a little on the heavier side, and they're like so skinny now. How are they getting so skinny? And
I love it. Adele, your revenge body is great.
Mindy Kaling, I was like, what? But like the thing is, though, she said, I'm also running. But it was how quick people were to say, oh no, this is because of the medication.
Yeah.
You must, and then it's like, no, maybe she's actually really running. Is that fair?
I hate that people regardless of whether she's using it or not, I hate that people, she just discredit that she was exercising, she was working out, she was sweating in California heat that's super dry. I don't know how I feel about the Kardashians still, but you gotta give it to them. They work out really hard. Yes, they have a trainer, but at the same time, they are still doing the weights. I mean, they're still doing the push-ups. Like, it is physically challenging to push yourself and push your body, especially when you're sore, especially when you're tired, especially when you're a mom or you've had a long day, to still go to the gym and dedicate 2 to 3 hours a day. That is work.
If we could take like all the negative energy people push to people and just change it to positive, we could do so much better, so much more good with it, so much more good with it.
I know. I hate, well, not hate, but like, it breaks my heart a little bit when I see people like breaking other people down, or like, I love it for you. I think that's my favorite like phrase. I love it for you. I love that you're able to do this. I wish I could do this. And it should motivate you, or I would like to think that I would motivate someone to do something more, do something better for themselves, instead of like oh, you shouldn't be doing this.
Yeah.
Blah, blah.
And I know that there are a lot of people that are like, it's a phase, it's a fad. Well, these medications have actually been around for a very long time.
Yeah.
It's just for the purpose of weight loss. It's newer, right?
Mm-hmm.
So I think one of the concerns is like, they're going to figure out that something terrible comes from these medications. And I'm like, well, they've been around long enough for that to have already happened. So I do think that there is going to be a longer term role for these medications. I think we're just still figuring out what that's going to be.
Right. And I have a feeling, knock on wood, I hope this never happens, but like one catastrophic event or something terrible is going to happen to one person, and they're going to be like, oh, this medication is going to kill everyone.
Erin's already happening. People are getting pregnant.
Oh, yeah.
Ozempic babies.
I love it. Good for them, though. Good for
I love that for them.
I love that for you.
No, I'm not calling babies catastrophic.
They're a miracle.
But yeah, so I do. I'm actually very excited to see where this goes because I think that there are going to be some people who may have initially needed surgical intervention who this actually might prevent them from requiring to have that surgery. And I think that if you can avoid surgery, even being a surgeon saying this, that why not? That's great. That's great.
I mean, we say it all the time. If you can do something, let's say you've already had surgery and you've regained the weight. I mean, you could always go through surgery again, but we usually always tell patients, go back to the gym. You did it before. You can do it again. Go back to the gym. You can work out. You can lifestyle. And at the end of the day, if you really tell me you've tried and you really just want to get it done, then yeah, obviously Dr. Rednam is more than happy to do that for you. But at the same time, it's like, put in the effort. You know, you got to put in the work. You got to like try to do this too. So.
I mean, just like the medication said, plastic surgery is the same thing. We can do so much, but you got to do your part. You got to do your maintenance. You got to work out because if it's not naturally under there, it's not going to magically appear.
Yeah. That muscle tone, no one but yourself can. We had that today where, you know, we've had patients who've had mommy makeovers or tummy tucks, and their abdomen, when they contract their muscles, it looks really great. It's flat, you know, but the moment they relax their muscles, everything underneath, everything gets really lax. And that is Pilates and planks and core work.
Yeah. To get that next level result, you know, we'll get you 70% there. You got to get yourself to 30% there. And so it still requires audience participation.
I always tell patients like slow and steady weight loss is always the best. And also because like I've talked to injectors like Myra and Jane from the med spa. They see this Ozempic phase where massive weight loss can be very gratifying because you are losing the weight so fast, but at the same time, it's going to wreak havoc on your body too. There are consequences to weight loss. I think the two main ones that I've come across are like the face, because your face does show your age quite a bit, and then the hair loss. Yeah, which has been really hard. Which is I don't know. The hair loss in the face.
And there's things obviously you can do to support it, and we've seen this with bariatric patients, like afterwards, and because they have no way of controlling how fast that weight comes off. But in those cases, this is a life or death situation sometimes, right? I'm taking control of my health. And so but with this medication, you potentially can do it at a little bit slower rate by not going up in your dosing quite as quickly. So yeah, I think that, you have to think about that there's always a little trade-off with things. And so if you're really hoping not to get some of those potential side effects, like do it slower because you can.
Like, why do you think like the face shows the weight loss so much?
I think, so part of a more youthful face, and they actually did this with celebrities, right? There's certain celebrities that are like, oh, they look so great, they age so great. Those celebrities don't allow themselves to get too thin, right? Especially in women. When they become very thin, as you age, it actually helps to put a little weight on to look more youthful, because having fatty tissue in your face looks better. So it's like, why is your face, you can't choose where the fat's going away from. And your face often does show when you've gained or lost weight pretty quickly. Right. And I think it's just because there's not that much fat in our face. And so if you're losing weight and you're losing it everywhere quickly, then your face is going to show it pretty easily. And so I think that's why you see it. And especially if somebody is doing this who maybe is only looking to lose a small amount of weight, then it's going to be more quickly, it's going to be done quickly, and it's going to be way more noticeable in their face because it's so quick.
Yeah.
Well, I think this was like a really good topic to talk about. I think it's very relevant to what we do. I'm excited to see where new research comes up with it and where we go from here. And then maybe a year from now, it's going to be like, yeah, no big deal, you know?
Well, they're coming out with a pill form of it.
Which is going to be a game changer.
Way game changer, and it's much more accessible. It's pills. You don't have to inject yourself anymore. And then apparently they say that the muscle mass loss is significantly less.
And there are things that people are putting into the medications or taking with the medications to try to reduce the muscle mass loss, because that is obviously a concern, is that not all weight loss is equal, and we want to be preserving our lean muscle mass and losing just fat.
Yeah. I mean, I've read, like, my friend went to a bariatric weight loss conference up in New York. And so you had a bunch of like weight loss surgeons and like bariatric surgeons and endocrinologists kind of come together. And so she was telling us the research. So there is muscle mass that is lost, but that comes with every weight loss.
Yeah.
Any weight loss, you're going to lose some muscle mass just because you're also not carrying the same amount of body weight, right? So if you lose 15-20% of your body weight, you're not carrying the same amount, so you're not lifting as much. So yes, unless you go back to the gym and go lift weights, you're gonna lose that body mass. So but they're saying that it's not anything more than what's expected of bariatric surgery or what regular body like weight loss.
You really can't target fat only unless you're having liposuction. I mean, and I'm not
do that for you.
And I'm not saying that that is a weight loss tool. It is a contouring tool, but really that is truly the only way you can say I'm only taking fat out.
Yeah.
So, so there's just no way to there's nothing out there currently that just targets your fat cells. So thank you so much, Erin. You are so knowledgeable on this, and I know it is something that you've become kind of passionate about, which I love. And we always try to do to other patients as much as we can. I tell people the more we can educate you, the less stressful things are, the more well-informed you're going to be, and the better you're going to be able to make your decisions.
Yeah.
So thank you so much for joining us on this episode of the Confidence Doc Podcast. And
brought to you by Ozempic.
I'm just kidding. And we will talk to you next time.
As we wrap up another episode of The Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.